Let's begin by taking a look at the trigger points that refer pain to the shoulder region. First, in red, we have the deltoid trigger points. On the right, you'll see the anterior deltoid trigger point that refers pain to the anterior and lateral shoulder regions. On the top, we have the middle deltoid trigger points, which refer pain locally to the lateral shoulder. And on the left, we have the posterior deltoid trigger point, which refers just to local pain to the back of the shoulder. Next, in purple, we have the infraspinatus trigger points, which refer pain deep in the anterior shoulder joint and down the front of the upper arm and slightly to the base of the skull. Next, in pink, we have the Teres minor trigger point, which refers a local spot of pain on the posterior shoulder region. Now in green, we have the Supraspinatus trigger points, which refer pain to the upper lateral part of the shoulder and the outside of the elbow. And next in yellow, we have the Subscapularis trigger points, which refer pain to the posterior shoulder and down the back of the arm, and can also severely limit shoulder range of motion. Now in blue, we have the Pectoralis major trigger points, which refer pain to the chest, to the anterior shoulder, and to the inside of the elbow. And next in orange, we have the Pectoralis minor trigger points, which refer pain to the anterior shoulder region. Let's take a look at the clinical findings for the deltoid trigger points. Clients with active trigger points in the deltoid muscle may complain of pain in the anterior, lateral, and posterior shoulder regions. And they may also say that the pain is experienced primarily when they move their shoulder. They're usually unable to raise their arm more than 90 degrees. And they also complain of a painful catch in their shoulder joint when they raise their arm to about 15 degrees. Some activating factors for trigger points in the deltoid include impact trauma, such as the recoil of a rifle on the shoulder, deep sea fishing, holding a power tool at shoulder height, and intramuscular injection as with a booster shot or flu shot. Let's take a look at the clinical findings for the infraspinatus trigger points. Clients with active trigger points in the infraspinatus will typically complain of intense and deep pain in the anterior shoulder joint that they describe as deep joint pain. The pain can extend down the front of the arm and into the hand, and it may be felt along the inside border of the scapula and the back of the neck as well. They will describe an inability to reach behind their back, as in when they're trying to reach for their wallet in a back pocket or trying to fasten their bra. And they will also say they're unable to lay on either side while they're sleeping. Some factors that may activate and perpetuate trigger points in the infraspinatus include unusual movements such as reaching behind them to brace themselves from a fall, a car accident, or throwing a ball. Clinical findings for the teres minor trigger point. Dr. Travell refers to this muscle as the little brother to the infraspinatus muscle. Associated symptoms include a well-localized spot of pain and tenderness in the posterior shoulder region. This pain is often confused with painful bursa or bursitis. Activating or perpetuating factors for a trigger point in the teres minor muscle include reaching out and behind the shoulder, holding on to the steering wheel during automobile accidents, and playing volleyball. Associated symptoms for the supraspinatus trigger points are as follows. Clients will complain of deep ache and tenderness in the lateral deltoid region, sometimes extending down the arm and into the lateral epicondyle at the elbow. The pain is felt when they abduct their arm and may also be present at rest. Clients will also describe a snapping or clicking sound that's present during movement of their shoulder. Activities such as combing their hair, shaving, or brushing their teeth are usually restricted by pain. Activating and perpetuating factors for the supraspinatus trigger points include walking a large dog that pulls on the leash, carrying a heavy briefcase, and any task that requires repetitive or prolonged raising of the arm. Clinical findings for the subscapularis muscle. Dr. Travell refers to this muscle as the frozen shoulder muscle. Your clients will typically complain of pain in the posterior shoulder and upper arm regions, and rarely they can complain of pain and tenderness in a very unique strap-like pattern around the wrist. They will complain of pain at rest and in motion. They have an inability to reach across their chest to the opposite armpit, and elevating their arm at 45 degrees is extremely painful. Activating and perpetuating factors for the subscapularis trigger point include swimming, forceful overhead lifting, reaching back at shoulder level to brace themselves for a fall, a tear of the joint capsule in the shoulder itself, prolonged immobilization of the shoulder, and a slumped, rounded shoulder posture. The clinical findings for the pectoralis major muscle are as follows. Clients will complain of chest pain, anterior shoulder pain, pain down the ulnar aspect of the forearm and into the fourth and fifth fingers, breast tenderness or nipple hypersensitivity. If the pain is on the left side of the chest and arm, it can easily be confused with cardiac pain. A lot of times when your client complains of chest pain, they will also complain of pain between the shoulder blades. Some activating and perpetuating factors for pectoralis major trigger points include the head forward rounded shoulder posture, heavy lifting with the arms out in front of the body, use of hedge clippers, immobilization of the arm, chilling of the pec major muscle, high levels of anxiety, and possibly pain from a previous heart attack. Here are some associated symptoms for pectoralis minor trigger points. Your clients will complain of pain in the anterior shoulder and chest regions. A tight pec minor muscle can also cause neurovascular entrapment in the armpit region, and this can cause pain, numbness, tingling, and edema or swelling along the inside of the arm, forearm, and into the hand. Trigger point activating and perpetuating factors for the pec minor include car accidents, impact trauma directly to the chest, use of crutches, severe coughing, high levels of anxiety, carrying a heavy bag with a strap over the shoulder, and the head forward rounded shoulder posture.